Thank you, Mr. Chair. There's a number of issues I'd like to raise in my allotted time, but I want to begin by just commenting. Appreciate Dr. Parker, you mentioning that, yes, dates, ability, how quickly we pounced on COVID, the existence of a strategy, the existence of a plan, whether or not that plan was implemented on a timely basis or completely is a worthwhile discussion because our public health experts and disease control personnel do not operate in a vacuum. And I'll leave it at that. First question I want to raise, as the senator who represents Lawrence Livermore National Lab in California. It's part of our national lab infrastructure, but Livermore in particular, and the labs in general, are critical to advancing our ability to counter weapons of mass destruction. The lab's mission includes work at the nexus of biology, engineering, and the physical sciences to address national challenges in biosecurity, chemical security, bioenergy, and human health. The partnership specifically between the Countering Weapons of Mass Destruction Office and the national labs is an important piece of our government's response to developing exceptional science and technology that can detect and mitigate weapons of mass destruction. So I'd like to ask each of you just some initial thoughts on the importance of partnerships between DHS and other government entities, including national labs, and how you view that partnership developing as this committee considers the future of these efforts. We'll start with Dr. George, Dr. Parker, and then Mr. Curry.
Thank you, Senator. Of course, those kinds of partnerships are absolutely critical, but they need to be focused as well. You're talking about science and technology. The national labs, NASA, DARPA, all of these science-oriented, mission-oriented entities can be utilized and worked with in any number of ways. But, in this case, we're talking about basic science. We're talking about the scientific endeavor. And I think you have to ask, when we're talking about which organizational element ought to be working with them from the department, we have to ask, is it appropriate for the CWMD office or the Science and Technology office to be conducting those partnerships? I submit to you that if this is a basic science issue that we're talking about, and for example, with BioWatch, then 19 years of the Office of Health Affairs and then CWMD trying to engage and then sometimes not engaging with the national labs and so forth is enough and problematic. They probably should never have been doing it. I think it should have been the Science and Technology Directorate that had been doing it. I think the national labs stand by. Livermore produced the first BioWatch detector anyhow. I am confident that the national labs and the other science and technology organizations throughout the country could address this if given the opportunity.
Okay. Dr. Parker, briefly.
Sure, and yeah, thanks. And first, I'm a big fan of Lawrence Livermore National Lab and get the opportunity to in fact, I think maybe next month. But anyway, I think Lawrence Livermore National Lab and the other national labs actually have an incredibly important part to play here. And one reason why they're so effective is that they can get into the very deep basic science, but they approach it from an operational perspective. And that's one thing that's really unique about our national labs and Livermore in particular. So I think anything we can do to encourage actually the re-engagement of S&T into the transformative science that is needed for detection, diagnostics, and surveillance and data informatics, which is another strength of the lab, needs to be encouraged and take advantage of that unique scientific expertise that our national labs in Livermore specifically that has an operational orientation.
Okay. Mr. Kerr, I'm interested in your thoughts, but I want to actually ask you a specific question on a different topic here in a second. A follow-up question for Dr. Parker. As you know, robust and timely data has become an essential tool in effective government responses. Unfortunately, when it came to COVID, COVID proved how the lack of data or timely data can cause harm and stalled responses to biological incidents. Multiple agencies reported issues tracking health data and coordinating with the federal government to ensure that we had a full and complete picture of the pandemic. Wish we had it much earlier on. In some cases, states did not report or collect, whether it was racial data or other data that would have been illuminating until we were well into the pandemic. Can you describe our current capabilities or lack thereof to track health data in a way that would allow us to more quickly identify and neutralize biological threats? I know we kind of ventured into this under Senator Portman's questions, but anything
Sure.
more precise and what recommendations?
Yeah, sure. I mean, I can share some personal, just observations when I had a front line when I was detailed back to Asper at the end of last year during the COVID response. And actually, it took several months actually before the data analytics and the ability to, have a comprehensive view down to the zip code level of hospitalizations, death cases, and so forth. It was not until hospitals started being able to tap the data from the hospital system that we began to get that, and that was 6 months into COVID. And so we've got to be able to kind of take those lessons learned as we go forward and not let those systems be atrophy, for lack of a better term at the moment. We've got to do this, and it's hard. I mean, because the data is owned by many different organizations, so this is not an easy challenge. But we've got to figure out how do we keep those pipes open when there is a crisis. They can be turned on instantaneously so that we can get the situation awareness that's needed.
Yeah, it's never would have imagined a day when the general public is tracking cases, deaths, hospitalization rates, and distinction between hospitalization, ICUs, ventilators, positivity rates, et cetera. And we haven't even scratched the surface on this variant versus that variant by zip code.
Well,
Mr. Chair, I know my time is just about up, but I do have one more topic I'm eager to get Mr. Curry's thoughts on, and it's this. As we know, COVID-19 has exposed significant inequities in our healthcare system as well as pandemic response. In particular, the pandemic has highlighted the racial and income disparities in our approach to public health. Hospitalization and emergency department visits were significantly and persistently higher among minority populations, while vaccination rates lagged in those very same communities. And this was the case across the country. There's clear evidence of the stark contrast between those with resources faring better during emergencies versus communities, families, individuals without sufficient resources. So as we think about ensuring our biodefense response and how we can build on the lessons learned during the COVID pandemic, I think it's critical that we're intentional about addressing equity and the unique needs of minority and other vulnerable populations. For example, some residents do not have access to reliable high-speed internet, or communities whose primary or preferred language is not English. Linguistic barriers have long been recognized as a contributing factor to health disparities. So, Mr. Curry, how can the government better plan to address these racial and other disparities in biothreat responses, and what recommendations would you have for the committee on how we not repeat the COVID experience and do better in the future?
Thank you, Senator. I mean, I think the first step is recognizing the issue, recognizing the problem. And I think, the administration has put out executive orders last year on focusing federal programs better on racial equity and other equity issues. That's one step. But another thing, I think, I'll just go back to the data. I think part of the problem we saw at the beginning of COVID, and we see this in other disasters too, for disaster assistance programs, is that there's really not a lot of data and wasn't a lot of data on how these programs impact certain populations, certain parts of the country, rural versus urban. And that created a lot of questions about how effective they were, and makes it really difficult for the federal government to target resources as well. So I think that's a first step we have to take to get better at this.
All right. Thank you very much. Look forward to following up with you. Thank you, Mr. Chair.